They now know that rather than one single disease, schizophrenia is probably a collection of separate diseases that manifest themselves differently in different patients. And although they don't fully understand what's behind schizophrenia, they do know what schizophrenia is not.
Despite the name, despite what people say, it is not a split personality.
The root of the word schizophrenia is a German word meaning to split. But this refers to the fact that patients afflicted with the disease become split off from society, a syndrome that all starts with a diseased brain.
Schizophrenia doesn't occur because your parents treated you badly or because some other insult. It is an organic brain syndrome. There are many different types of it, but it's organic, it's physical, it's a physical illness from which people can suffer. I often say it's as physical as ingrowing toenails, just the downside more severe.
The causes seem to be complex. First come genetic factors. For example, individuals have a markedly higher chance of developing schizophrenia if one or both parents has it. But faulty genes alone don't seem to be enough to cause schizophrenia. Research shows that some environmental trigger may interact with genetic factors to kick it off, probably when an individual is still in the womb.
Any kind of damage that occurs to the fetus, particularly in the second trimester, seems to be associated with an increased chance of getting it. So viral infections, starvation, lots of different types of obstetric injuries seem to be associated with an increased risk.
As a result, evidence of schizophrenia can be seen in the brains of patients from infancy. First, their brains are smaller than those of healthy people and remain that way into adulthood. And there are other noticeable abnormalities, such as enlarged brain ventricles that carry the fluid that maintains uniform pressure throughout the brain. And these abnormal brain functions manifest themselves in a range of symptoms, from hallucinations and delusions to disorganized speech. These are called positive symptoms because people with schizophrenia have them and healthy people don't.
The most common is hearing voices. Imagine what it is like to constantly hear these voices talking to you, saying things. You smell, you're bad, you're evil, you should die. Then other voices will tell them things, they'll tell them what to do, command them. You must go and jump off a bridge, you should go and shoot somebody. And then sometimes the voices will actually talk to each other about the person. So one will say to another, I don't like the trousers he's wearing today, or something like that. Then people also can get visions, they can see things, visual hallucinations, and sometimes they can feel things running up their skin or like electricity. This happens more often with drugs, but we see this. Or they can smell things or taste things. Now those would all be hallucinations. They're false perceptions, but they are as real to the person as anything that you or I hear or smell or taste. It's like
Other symptoms are termed negative because they represent an absence of normal human behavior.
It is a lack of will, a lack of ability to initiate actions. People lose the ability to socialize. People lose the ability to produce language. And in particular, they lose the ability to have any pleasure. Imagine never again being able to enjoy pleasure in anything. Anything you eat, anything you see, anything you read, nothing. But it's this asociality which can be very severe. Men get these negative symptoms worse than women do. Imagine somebody you love, you care about, that used to come down and they'd be part of the family and you talk about your day and so on. They don't talk, they don't socialize, they sit there on their own staring at the wall or staring at the television set, and they don't do anything else. Autism was introduced in 1952. It was an absolute breakthrough, and it started really making a dent in these huge populations that were in the old state hospitals. That began to change when the medicines came along.
But the medication also had pronounced side effects in patients, including serious motor disturbances such as shaking and shuffling, as well as impotence in men. A desire to avoid these side effects reinforced many patients' tendency to not take their medication because they didn't believe they were ill. In the last decade, a new generation of drugs has revolutionized treatment for many patients. These include clozapine, olanzapine, risperidone, and quetiapine. Researchers don't fully understand how these drugs work, although the medications may influence the chemical neurotransmitters that send nerve impulses throughout the brain. But these newer drugs don't produce the uncomfortable side effects of earlier medications, and they are especially effective at treating patients' negative symptoms, such as apathy and social withdrawal. As a result, patients may be more likely to keep taking their